Ambulance ramping is at quite shocking levels in Queensland, and last week I was talking with the local member in the Redlands area, Mark Robinson. He told me it was over 60% in that district, but I think that's representative of how bad it is across the state. What do ramping rates mean for a person who needs emergency health care?
Well, Queensland has the worst ambulance ramping rate in the nation. Let me say that again. Queensland has the worst ramping in the nation at 43%. Logan Hospital, for instance, is at 67%. And what that means is those hardworking paramedics who didn't sign up to sit on the end of a ramp for 5.5 hours, it means that they cannot get to your loved ones. It means that if your father's having a heart attack or your mother's had a stroke or your child's having an asthma attack, you will be waiting longer for an ambulance, and that is just not good enough. The doctors and nurses are doing their utmost, and the only reason that ramping happens is because there is no room at the inn. There are no beds in our hospital, and this government spruiks a good game, but most of the beds that they're talking about now won't be coming online until 2027, and that is just not good enough, and it's too late.
It's a sign of how bad things are that patients have started being stashed in resorts like SeaWorld rather than being treated in a hospital. Why is this needed, and what needs to be done to turn it around?
Well, this is another symptom of a Labor government that's given up on governing. They should have made sure that we had the proper resources in the first place. I mean, the Gold Coast, for instance, is one of the biggest cities in the state. We have been talking about the need for an 800-bed hospital in the northern part of the Gold Coast for at least 6 years. We need to make sure that we're not counting hotel beds as hospital beds, and that's something that this government's really good at. They are very good at hiding the data, and the only reason we find out is if we do a freedom of information, and even then they try and wash the data.
It was really repugnant, in my view, to see Labor MPs laughing and carrying on at the same time as their management incompetence saw patients being shoved into the SeaWorld resort. I mean, what does this tell you and tell all Queenslanders about how seriously or frivolously Labor are treating this health crisis?
What it shows is that this is an arrogant, out-of-touch Labor government that has been in power for 8 years, 3 terms and 8 years. And what both Shannon Fentiman and Grace displayed the other day in the Parliament was atrocious. If you are sitting at home waiting for an ambulance, or if you're sitting at home waiting on the waiting list to see a specialist, it is not funny. And Shannon Fentiman has got form. This is the worst child safety minister that Queensland has ever had. This woman has been the Child Safety Minister and the Minister for Women and the Minister for Domestic Violence over the last 8 years. During that time, we've seen 149 women perish from domestic violence murders. We have seen 42 children who have died under suspicious circumstances, and this woman is going to be in charge of Queensland Health. What we saw with the supposed reshuffle 2 weeks ago, it's the same faces round the same table with the same premier on the same wage, and nothing is going to change because they have given up looking after Queenslanders or caring for Queenslanders.
Finally, Ros, what's needed to deliver a world-class health system that Queenslanders can depend on in their hour of need?
Well, Queenslanders do deserve a world-class health system, and that's why we implore the Labor government to take the LNP's policies. Things like real-time data monitoring, so we can see what's happening in our hospitals on the waiting ramp, on the ramps at the moment. I can see that in New South Wales right now, but I can't see it in Queensland. Better resourcing, which means more beds, but we also need to make sure that we've got workforce planning, and that hasn't occurred under this government. On top of that, we need to have better triaging, but more importantly, we need to put our doctors and nurses back in charge of their hospitals because they know how to run it, and Palaszczuk and her cronies have no idea.
Ladies and gentlemen, I told you this woman knows what's needed to turn a health system around. Ros Bates, thank you so much for your time tonight. Keep up the good work.